Thank you for joining us for another eFusion webinar. This is Kristen Hall. I'm proud to present today's topic, which is eFusion, our care management tracking platform. And we're going to be discussing some hot topics that have been brought to our attention from our clients. Our presenters today are Paul Phelps, Senior Business System Analyst, and Amanda Connoyer, Regional Clinical Director. I'll go ahead and kick it off to you, Amanda.
Thank you, Kristen. As Kristen told us, we're going to be talking about some of the hot topics or frequently asked questions that Paul and I have gotten over the last several months with eFusion. Hopefully it will help you guys be able to use eFusion more fluently and really get the most out of using this system. So I know eFusion allows flexibility to match our clients' workflows. Paul, could you please show us some ways that we can help really make task specific for our clients' workflows to make sure that it allows them to be more efficient and flow with their normal workflow?
Yeah, absolutely, Amanda. So the great thing about eFusion is that it has the ability to customize any type of episode's workflow for that care manager who's going to be working with that patient for that episode. So if I actually go down to this workflow configuration, workflow tasks, and again, this is all under the administrator role privileges, I can find an episode. And once I go to the workflow configuration page, you're going to see I'm able to adjust the workflows of any one of the episodes I have or I'm contracted to in the BPCI Advanced program within eFusion. So if I choose to go ahead and not use the week 1 calls, I could uncheck that and it would not default on my timeline. I would be able to adjust the due dates. I'd be able to decide what I want to include or not include in my additional or add task button on the timeline. So once I go ahead and do that actual intake for the patient, you'll see here that my timeline is built out and configured and fully customized to whatever I need it to be for that care manager.
So, Paul, one of the big things that I think a lot of people struggle with is that the majority of their patients are going to go home after they're in the hospital, and they have that day 1 home, sniff, and IRF tasks on their timeline. Is there a way that they could just have the home task be available, but the sniff and IRF are available if they need it, but it's not going to show up on their case management dashboard and on that timeline for every patient?
Yeah, absolutely. So if I actually go back to that workflow configuration page, so I'm actually just going to hit the back button here. You'll see that we actually have a layout that's actually set up this way, so you can see it right off the bat. So you can go ahead and uncheck the 3 post-op tasks that are available here, and then that way when they don't default, that they don't default when you actually go through and do the patient intake or patient enrollment. And actually the timeline I have set up here for this patient Taylor Hall, you'll be able to see that. So you'll see that all 3 of those tasks are not falling into the timeline automatically. Actually you can go to the add task button and be able to add them at any time. So if I wanted to, if my patient ended up going home after that surgery, I can actually just add that directly to the timeline. Now, Amanda, what do you see a lot of our clients doing in terms of how they have it set up? Do they take all the tasks away, or are they doing something else?
Yeah, so a lot of our clients, what we've been recommending that they do is leave that day 1 home task on there configured so that it shows up on that timeline, shows up on your case management dashboard, reminds you that on day 1 when the patient gets home that they need to make that call. But then leaving those sniff and IRF tasks unchecked so that they show up in that add task button. Then that way, if the patient does go to sniff or IRF instead of home, they can just easily delete the home task off of the timeline and add the sniff or the IRF task with the add task button. Just kind of gives you that, hey, don't forget about me kind of thing.
So we're looking at something that kind of looks like this, right?
Exactly.
Okay, so then we'd hit save on this. And then what that would do is, that basically set that up for all the patients moving forward. So you'd have to go back and actually add those home tasks to any patient that's already gone through an enrollment. But anybody who's been enrolled after that fact would have that setup that Amanda was talking about. But with that being said, while we're spending some time on the timeline, you'll notice that I have 2 different types of risk assessments on here, Amanda. What's the difference between these 2 Which ones do you recommend that our customers use, and how have our customers been utilizing them?
Yeah, that's also another really good question and a hot topic. So there are two different risk assessments for some of our episodes. The long form risk assessment can be used, or the primary risk assessment can be used across any of the episodes. It is very thorough and goes through every system, but uses the biopsychosocial model, so it goes through all the social needs of a patient, as well as their medical and then also their psychological. So it is quite lengthy. As I said, it can be used for any episode, so it's a little more generic. So it kind of depends on what you're looking for, whereas the short form risk assessment is actually a condensed version and is specific for a particular episode. So you'll notice that not all the episodes have that yet. We have one for like lower extremity and upper extremity, spine, and ortho trauma. So when you're using the short form risk assessment, it's not going to ask every single question that you may think of off the top of your head that needs to be asked to a question, because it is that condensed version and it is honed in on just one particular subset of patients, where that long one is not. And so a lot of my clients, what they are doing is using the short form risk assessment. If they get a high result, they'll pull in that primary risk assessment to be able to get some additional information about the patients. I do have some groups that just prefer the primary risk assessment, so that's the only one that they'll use. So it's kind of up to the group how they want to do it, but both are evidence-based and both are based on statistical data. So you can use either one, and whichever one works best for your practice.
Great, great. And you're only allowed to have one of those per patient, correct?
Correct. And Paul, would you show them how they would go about setting that up in the workflow as well?
Yeah, absolutely. So if you could actually, we go back to this workflow configuration page and this workflow tasks. So again, this is what Amanda had referred to, kind of as you get familiarized and comfortable with the system, you find out, which one's going to work for you best. You can go ahead and, select or deselect either one of those. So let's say, we want to just use the primary risk assessment, like some of those customers that Amanda had referred to. I'd just be checking that off and then not checking off my short form risk assessment. And then that way, anytime I do an enrollment, they're automatically going to get that primary risk assessment falling on that timeline. And then if by chance, you had another one of those, a different care manager that maybe wanted to add the short form risk assessment, they could always, I'm just going to delete this first to show you. They can always just go back to their add task button. And as long as they don't have one on that patient yet, they can always just add that short form risk assessment later if they wanted to include it.
Great, Paul, thanks. Another thing that we hear a lot is that our case managers don't work on the weekends. Most of them work Monday through Friday. We do have some that work on the weekends. If they wanted to configure their workflow to not have tasks fall on the weekends so that they're not always running behind or, feeling like they have a bunch of stuff due on Monday when they go back, or being worried about missing something when it falls on that weekend, is there a way to configure the system so that their tasks don't fall on the weekends?
Yeah, absolutely. So this was an enhancement that I think went in maybe 1 or 2 months ago. So it could be, something that you might not know about, but under your administration tab in the left top hand corner here, you're going to see something called client settings. Under there is a setting that's going to allow you to basically adjust the due dates on all of your tasks to avoid weekends if you're choosing the one at the bottom here. So adjust due dates to not fall on weekends, where we would take any task that has the due date on a Saturday and move it back to a Friday, and then any task that had a due date on a Sunday and push those up to Monday. Now, to keep in mind, this is going to obviously affect anybody that's going through an enrollment after this fact, but we would processing the new and processing tasks to change at midnight after you had made this setting change, and we do document when you make that change. So yes, we do have the ability to do so.
Okay, great. Thanks, Paul. I think another thing that is something big that people have been asking for and talking about is to help keep their drop downs cleaned up and make it a little easier to manage eFusion. So is there a way to inactivate or hide providers?
Yeah, absolutely. So this is something that actually went in within the last 2 months as well. So fairly hot topic item that we've built an enhancement for. So if you actually go down to network management, and provider network. So this is under the administrator role as well. This is where you would come provider network to actually manage all of your providers. So if I was to go in and select one of those providers and go ahead and hit the edit button, you'll notice I have an active flag that's here. So if I wanted to inactivate one of these facilities, I could go ahead and select the inactivate or the active button and then include a reason, and that's gonna inactivate them. So we're gonna say not network for that one. And that's how you make them inactive. And then you'll notice as I go through some of the drop downs that I have throughout eFusion, you're gonna see that they're starting to hide those from those drop downs. But if I wanted to include them, if I wanted to backdate something or for some reason, I could see that they're still selectable, but for the default, just clean up the drop down so we can make it inactive.
Well, is there a way to reactivate it? Like if somebody were to come back to the practice, or I did it on accident, is there a way to reactivate a provider?
Absolutely. So this is not, set in stone. So if you wanted to go back and activate that provider that you had made inactive, go back to provider network. You can actually search what you've made inactive by, selecting the filter at the top here. We'll find, Johnson Regional Hospital, which we inactivated just now. You can notice that it's inactive. I'll hit the edit button. We go back and simply just check that active box again. Hit save. We've now made it active. And if I actually go back to that active filter, you'll see that Johnson Regional Hospital is now an active provider.
Well, while we're talking about providers, could you also show everybody how they would go about adding like a SNF or a home health and checking them as preferred, meaning that they're in their preferred network, their performance network?
Absolutely. And if I wanted to do so, I could go in, and it's kind of the same way we got to the active flag. You go ahead, Marion Manor Nursing Hospital. We'd be able to go to the edit button, and then we'd be able to check off this preferred provider checkbox. And now when I'm doing that, Amanda, why would be the reason why we'd be setting one of these as a preferred provider?
So this is going to be really important as you run reports and as our reports become more enhanced. We actually got this in with the current patient location report last month, and then the other post-acute care services summary report will have this feature next month, where on that report you will be able to actually filter by preferred provider or non-preferred provider. And so what that's going to help you do is determine who is within your performance network, and then you'll be able to look at your length of stays and see if one of your performance network participants is living up to the guidelines that we've set up for them. If they're not, kind of give you an idea of how to coach them and what things you need to concentrate on. It'll also allow you to compare your preferred to your non-preferred post-acute care network participants.
Oh, great.
So, Paul, with the inactive, going back to that, can they inactivate patients?
Yep. So the ability to inactivate patients is fairly similar to that of a provider. So where you would be managing that is on the patient management screen. So we'd go to patient management on our drop downs on the left, and then patient registration. We'd go ahead and find the patient that we want to inactivate. So let's say, Greg Anthony here, we want to inactivate him. We'd go ahead to go down to the bottom, hit edit, and then we have the active flag at the top here. So we'd be able to uncheck that active flag and then set a reason to it, whether it be, a duplicate patient because maybe it was a patient that was created beforehand and then now there's an interface set up so there's two patients and then they're the same. A couple different reasons that you might have, a patient in here. Maybe there's the patient's not actually in the BPCI Advanced program, whatever the reason might be. You select that reason, scroll to the bottom, and you hit save. And then that's going to make them inactive. And you'll notice that anything that's made inactive in eFusion is going to have these 3 asterisks next to it. And then we're just simply removing it from the dropdowns.
So do patients automatically inactivate when their episode is complete, like at the end of the 90 days?
So that is that's a great question, because that can be a common misconception. So the only reason, again, why you would want to inactivate a patient is maybe they're not supposed to be in eFusion. If you're inactivating a patient, all you're technically doing is taking them out of the dropdowns. We're never really pulling any data out of eFusion, and the actual process of going through and actually discharging a episode is not going to have any effect on that patient, only the episode, and it's the vice versa of that. If we do inactivate a patient, it's not going to do anything to the episode status. So it's always a manual process for a care manager to go in to a processing episode and be changing that episode status to discharging, to discharged after that 90-day period has been surpassed. But it will not automatically inactivate an episode after the episode has been completed.
And you did say that when they inactivate a patient, their data still stays in eFusion. It doesn't like remove everything that I've already put in there. It just takes them out of the drop downs, correct?
That is correct, and it's just some of the drop downs within eFusion. If you're still using that global patient search, you'll notice I have 4 examples in here of inactivated patients. We'll still be able to find those patients, and their episodes will still be within eFusion if you want to find those as well.
So can they also inactivate episodes? Because I know we have a lot of groups that have changed episodes with this model year 3, have gone to a placeholder only. Lots of things have changed there. So they can do the same thing with episodes, I would assume?
Absolutely, yeah. So the process for that is a little bit different. We're not using an active flag on the episodes as we are within our patients and our providers. So if I actually go to contract management, again, this falls all under this administrator role. I can go to episode management, and under episode management, you'll notice that we are able to maybe locate, you use a scenario of one of those older spinal episodes from model year 2, which has now been kind of rolled up into the spinal fusion episode for model year 3. If I select that episode and I hit edit, you'll notice that we have an end date. And then once that end date has been surpassed, that is when an episode is indicated as inactivated. So you'll be able to set this to, if it's you stopped following that episode at the beginning of the year, you can set this to inactive. And what that allows you to do is take that episode out of the drop downs when you're going through the patient intake screen. Now, one key thing to point out along with this is if you are, following patients that may have had a surgery right before the end of the year and you're inactivating their episodes, that's not going to have any effect on the episodes you're working on. It's perfectly fine to do so. All you're doing really when you're inactivating an episode or setting that end date to a past date is basically just hiding the episode from your drop down. So you'll notice that if I look through my drop down here on the patient intake screen, I can't see that cervical spinal fusion episode. If I want to include it and be able to see it, you'll see it at the bottom here as being inactivated. And any patient that's already in that episode that has maybe gone over and you're still following them into March or beginning of April for that 90-day period is not going to be affected by the inactivation of that episode.
Okay, great. And they can reactivate those and change the dates if they wanted to make sure that, when they come back in 2021, if they decide to add an episode back, they could just change that date and be able to reactivate that episode and start seeing patients in for that time frame again? Absolutely.
Yeah, so you just go right back in, you take that end date, extend that out to a future date, and it would make it active again.
Okay, great. So since we're on the same topic, we'll just keep rolling with it. What about users who have left the practice? Can they inactivate and activate users?
Yes, of course. So that's going to be managed on your user and role management screen. Everything is kind of similar to what we've been talking about. So if you wanted to inactivate a user who might have left the practice like you had mentioned, you'll be able to go in, find that user, go to the edit page by hitting the little pencil, and you'll notice we have an active flag here. You would put, uncheck that active flag. We're going to put in, employee left organization. We'll hit save, and then that's going to inactivate that user. Now, I know exactly where you're going next, Amanda. Can they be reactivated? The answer is yes. I'm going to go ahead and show you the inverse of that. So we would go to this this user, click off the checkbox. We can remove the reason and hit save, and simply just reactivate that user as well.
Okay, great. So that was easy. That's
Yeah.
nice. Um,
So, oh, I got a question for you. So, moving on to the next topic, what is the difference between operational reports and analytics in eFusion?
That is a good question, and that is one that we've gotten quite a bit. So most of our users will notice that when you're setting up a new user in the eFusion system, you have to choose what kind of reporting you want them to have. Do you want them to have administrative reporting, case management reporting, or analytic reporting? So the administrative and the case manager reporting are tied to the option in the menu that's called reporting. Yes, right there. And operational reporting is real-time reports. So the reports under this operational report are only going to be as good as the information that's being put into eFusion by the users. So it is all based on the information that's being put into, say, the plan of care or the BNL options. All of that stuff is what our team is able to pull and put this in. This has nothing to do with the claims that come in from CMS. This is strictly eFusion reporting based on that information. The analytics reporting, you'll see a couple different options over there. You'll see the Excel ESR. This is that monthly file that we had previously, your regional team had been sending to you with your CMS claims. So that's going to be the financial information that we get from the billable claims that come in. The same thing with the bottom three options in this. Those are our Power BI platform. And so those are the ones where you can actually drill down into like readmission reasons or the actual cost for the patient and get down to that nitty-gritty detail. So they're both very helpful because you can compare and contrast what you have, but they both do serve two different functionalities. You know, if you want to look more at financial and key performance indicators and utilization percentiles, you're going to want to look at that analytics section. If you want to see how things are going in real time, you know, with who's going where and what's happening with our program right now, as opposed to the delayed that we're seeing with the analytics, you'll be able to pull that reporting from the reporting tab and be able to do that right out of eFusion.
Great. Yeah, and I know I get that question a lot in training, so it's helpful to know the distinction between the two for sure. With that being said, as we're talking about, you know, certain types of requirements, with the BNL being one of the quality measures for groups to choose from, is it important? It's important that they document it, obviously, that the patient that's been received by the patient. Where can you do this in eFusion?
So we actually have a couple different ways. Paul, if you want to go to the first one on the intake, yeah, there we go. So when you are doing your intake for your patients, this was one of the things that we had a lot of users request, just to make it a little easier whenever you're putting the patient into the system, because typically you've already given that or sent that BNL to the patient, however your workflow is normally doing it. So down here, a little bit above the bottom, you have the ability to say, yes, the patient received the BNL. You gave it to him, you emailed it, you mailed it, whatever you're doing it, and then the date that you transmitted that to the patient, and you can hit save when you're actually putting that patient into the episode. The other couple ways, Paul's just going to go to a patient profile here. Hang on one second. Is to go into the patient demographics. This is the way that we've had it for a little while. Down here at the very bottom, you can then do the same thing where you can say, yes, the patient received the BNL, and then put the date that they received it. And then the last thing that you can do is if you hover over that, you'll see that since you updated the BNL information in either the intake or on the patient demographic, you'll see that it says BNL yes, and when you hover over it, it'll give you that information as to when the patient actually got that form.
Great. Yeah. So and again, I know that's something that's, you know, frequently asked. And Amanda, that beneficiary notification letter, how do they get that actual document?
So that's something that would have been given to all of our groups in their implementation process. If you are not sure about that document, or you know whether you have the most updated version, you should, but you can always reach out to your regional team and they'll be able to help you with that.
Perfect.
While we're actually on the patient profile, can you show us how to adjust the timeline suit multiple workflows? I know we have a couple people that like to do things different ways, or maybe have long notes or short notes. Can you kind of walk us through some of that?
Yeah, absolutely. So that's a good question, because when it comes to, obviously how our customers work, their workflows can be very drastic and different between all of them. So what we've noticed is that there's a couple different ways that you can kind of manipulate the timeline. So, some of our customers are honed in on using all of those assessments, whereas, some might be using the assessments and the notes, and some might be using just the notes. Either way, this timeline, as you can imagine, can get pretty lengthy. And with that being said, while you're working from top down, a lot of those notes are going to start to stack up, which is going to cause for a lot of for the timeline to expand, and as a user, you having to actually scroll down the page quite a bit to get where you need to go. We actually have installed a new enhancement where we're able to actually invert that timeline. So if you actually click on this, the column header here, it's going to put all of your furthest dates at the top, which is going to allow you to see when your newest task is. And we have, some of our clients doing that to see what that next task is before having to go through all of the notes. They can also obviously see the most recent note right below that. So it just makes it a little bit easier for them to go ahead and do that. Another thing to mention about inverting those notes is that this is a persistent or sticky setting for that patient, specifically for that episode. So if I was to go out and go to, the CM dashboard, and then maybe I want to go back to that last page, you're going to notice that that date inversion is going to stay. So it makes it easier for that user to be able to basically go ahead and just, set the timeline for that patient, for that episode, the way they want to see it.
And it's just for that particular patient. That doesn't apply to every single patient. If they invert it for this patient, when they go into their next patient, it'll be however they left it, whether it's chronological or reverse.
Absolutely, yeah. So actually, to get even further into that, it's actually episode specific. So if you had a patient that had multiple episodes, you would have to invert it for each one of those episodes for that to take place. If a patient, if you set it for one episode for that patient, it would be there. But if they have multiple episodes, you'd have to set it for each one of those episodes, yes.
Got it.
Okay. But with that being said, they naturally wouldn't have, two episodes operating at the same time, right, Amanda?
Exactly, yes.
So when we start to talk about, one of the hot topics, or one of the bigger pieces on the patient profile, we focus in on that plan of care, and specifically before that, we talk about that discharge date from the anchor hospitalization. So why is it important that care managers are putting that information in?
So that's actually a really good question, Paul. The reason for that is because it actually does impact their timeline. So if we go into excuse me, our surgery or our anchor hospitalization tile, depending on if you have a medical or surgical episode, and you hit that edit button there.
Let me give you a brand new patient. How's that?
Sounds good.
All right.
So if you notice on this patient, they have the surgery date, but they don't have the discharge date. So that surgery date, by putting that in, it's going to start estimating the due dates for your timeline tasks. However, because we don't know when the patient is getting discharged, because you haven't put that information in yet, the dates up in your timeline are all going to be based on that admission date. So they're going to be off. They're not going to be 1 week after they got discharged, because they don't know, the system doesn't know when the patient got discharged yet. So once you go into that surgery or that admission tile and you put that discharge date in as, let's see, 2/7, and hit save, what's going to actually happen is that your timeline tasks are going to line up with when they should be calculated based on your workflow and the discharge date and the admission date. So your pre-acute tasks are going to be based on that admission date, whereas your post-acute tasks are going to be based on that discharge date. So it's important to put both of those in. The other thing is that your program discharge date is based on the discharge from the anchor hospitalization, because it's 90 days after the patient gets discharged. So it's important to have that so that you have the accurate dates for all of those things.
That's great. Yeah. And another place, that is going to affect is obviously the plan of care, like I had mentioned before, that's going to, start to hard code some of that information there. But along with that, that acute or that anchor hospitalization information that's in the plan of care, we want to talk about, some of the post-acute care resources or the appointments or the readmissions that happen in there. So why is it so important to put in the estimated and actual dates for those type of resources?
So that's very, very important in eFusion. As we talked about before with our reporting, a lot of our reporting is all pulled off of the information that's being put into eFusion. So if you're trying to get length of stays or utilization information, or you want to see where all your patients are right now, if you're not going in and putting in those estimated and those actual discharge dates, you're going to have skewed results. It's going to look like patients are staying in skilled nursing for 300 days. Or if you don't put the actual admission date, it's going to look like a patient never got admitted to skilled nursing. So it's really important that we put those dates in so that you get the most out of your reports and so that you can make those real-time adjustments that you need to make. So Paul, if you want to just click on the post-acute phase of care, and then go ahead and add a post-acute care resource. And then let's just go ahead and put a skilled nursing in. So the other thing that's really important as you're going in and you're updating your plan of care is to put the resources in for the full 90 days with their estimated date. So we'll come in, your surgery or your anchor hospitalization information pulls off of that tile that we were just on, but you want to come in, okay, when they get discharged from the anchor hospitalization, where are they going? So this patient, we're going to say, is going to skilled nursing. They're going to get admitted on 2/7 because that's when they got discharged from the hospital. So 2/7, their estimated discharge date, let's say it was 2 weeks, so let's say the 21st. And then we know they actually got admitted because we're past that date there. And then go ahead and hit save. And then I want to come in and say, okay, after they go there, I know they're going to go to outpatient PT. So I'm going to put another post-acute care resource in. Home with, yeah, either one is fine.
Either one, okay.
Yeah. And let's say that they're going to get 7 visits of let's say 15 visits of outpatient PT, just for fun. And we're going to start that on, we're estimating that one to start on the 24th. And we'll say that it's going to run for 4 weeks. So we'll go into March sometime. And then hit save. And then I want to finish it with putting in the home without resources. And I want that last date to be on the date that they're going to be discharged from the episode.
So what are the dates we're putting in here, Amanda?
The date that they would have been done with PT, which was
Okay.
March.
The 9th? Yep, so the 10th.
And then their estimated discharge was 5/6 from the episode, I believe. And then hit save. So as you can see, I filled out this whole plan of care for their full 90 days, and that's what you want to do. And then as those dates actually come about, we want to come in and put the actual dates in. And it's okay if they don't match up, because sometimes they don't. That gives you an idea of, hey, we planned on this patient being there for 2 weeks, but this nursing home isn't working with us and they kept them for 5 weeks, right? We want to know that information. So it's okay if your estimated and your actual dates don't match up, but it's really important that you come in and put those in, because that's what's going to drive those reports that you'll be able to pull real time, so you don't have to wait for the delayed reports coming from CMS. The other thing about the plan of care that's going to be really important is that adding your readmission information. So just like Paul just added all of these post-acute phase of care options, you can actually add your readmission information in here too. We do have a readmission report, and so it's going to be important that you're putting that information in. Again, the claims from CMS are delayed, so if you put hospital readmit and you put where they went And usually for the readmissions, you know after they were there. So if you don't put the estimated dates in for readmissions, that's okay. You can put the actual dates that they got readmitted. Paul, you can just make something up here. And then the other thing that's going to be important is with the latest plan of care enhancements is that you can actually put the reason in. And with that, that's going to allow you, when you run that report, to be able to look at the reasons or the notes that you put in and say, hey, it looks like all my patients are getting readmitted for COPD. This is something that we need to take a look at as a practice. So it's really important that you keep that plan of care updated. It's really going to help drive your reports, help drive faster change in your practice, because you'll be able to see it before we see it with the claims data.
Awesome. Yeah, a lot of great information there. Now, is this also a place that you're able to put in your appointments as well?
Absolutely. So if you go back to that post-acute phase of care, and the other option that's available in there are appointments. So a lot of our groups are using these to be able to determine if patients are actually coming in and having their post-acute follow-up. So, you know, are they coming in and seeing their doctors at 7, 10, 14 days? Are they following up like they're supposed to? I know some of our practices have started implementing a 7 to 10 day follow-up with their provider in office when they're in skilled nursing, just to try to get the patient in there sooner to get evaluated, to make sure, you know, that they're being seen in a timely manner and getting out of the skilled nursing in a timely manner. And so this is a way that you can see that those are being made. Maybe, you know, evaluate for, is the skilled nursing bringing them to their visits like they're supposed to? Is the patient following up like they're supposed to? Is there a gap in our workflow? So you can also put those appointments here and be able to determine exactly, you know, any changes that may need to be made within your practice. And then one thing that's really important when you're done with this plan of care, if you scroll down to the bottom, you want to make sure that you save and sign it whenever you're done with it. You can just hit save. I recommend always saving and signing, because you can always go back in and edit this document at any time. But what this does is, if I made all these changes and Paul came in behind me to make changes, he would have to validate that everything's correct, because the only thing that he has the option to do is save and sign it. So it'll tell you who the last person to sign this document was.
Yeah, I mean, I think that's pretty huge in terms of, you know, just being able to keep up with, you know, who's making the newest edits to that plan of care, correct?
Exactly. It kind of just covers yourself, you know, make sure that we're not saying that Amanda made these changes when really Paul came in and messed everything up that I just did. So
Usually that's the case.
it is
It's
usually the
definitely
case. Yeah, it's totally the case.
Now I know you mentioned a couple of the reports that these affect. You mind just kind of talking about a couple of them on the operational report screen?
Sure. So the big ones, first of all, the BNL status report. We talked about the BNL and the importance of putting that information in. You can actually pull this report and see the status. Is it that you just didn't document anything? Is it that the patient didn't get it, you didn't send it out? You can pull that report and be able to look at that. The other ones that I see a lot of our groups using, and it's based on the information that they're putting in that plan of care, is the current patient location report. This is going to tell you where your patient is right now. So once that patient has been admitted to skilled nursing, until you go and put that actual discharge date, that patient's going to be sitting in skilled nursing. So that's one that a lot of people use so that they can just talk to the skilled nursing about all their patients at one time. The hospital readmission and ER urgent care report, that will give you the ability to look at patients who have had readmissions during a specific time frame. So that's really important, especially if you're trying to lower your readmission rates. Using that report to do that in real time is going to be very important. And then the other one that is driven off of that plan of care is the post-acute care summary services summary report. Oh, that's a mouthful. That one is actually going to look at all the post-acute care services that all of your patients have used during a particular time frame. That one's really very helpful, because it's kind of like your utilization report that you guys are seeing with the CMS claims. So it'll give you a list of all the patients that went to skilled nursing or home health or inpatient rehab. You can filter it down to look for a particular subset of post-acute care if you want to. So those are the ones that are practices and our hospitals are using a lot, because you can actually get that information and make those important changes to your program quickly.
Awesome. Yeah, I definitely a lot of great reports on here in terms of just being able to pull out all the documentation that you're inputting into eFusion.
Absolutely. And, Paul, one of the other things, when our case managers are working on a patient like we were with that plan of care, we're in that patient where, we know which patient we want to go to next because it's just part of our normal workflow. If I don't want to go back to the enrolled patient screen because I then have to go back and search and do all this stuff, is there an easier way to do that, or is the enrolled patient screen the easiest way to transition from patient to patient?
It's a great question. And we did have, a major enhancement that kind of went in recently. I think it's maybe 5 months back. This global patient search, or last 10 patients viewed at the top here. So this box is available on every page. And it is my main focus of navigation when I'm ever in eFusion, as well as most of our care managers that work within eFusion. So if you actually click on this box, you're going to see that it's going to give me my last 10 patients viewed. The last 10 patients viewed is whether you were on their patient profile page or their patient details page. So if you're creating a patient, it's going to add them to this list. If you're going to a patient's profile where you're living for the entirety of that episode, or where you're going to open tasks and work on assessments, it's going to add them to this list. It's going to make it a lot easier for you to recognize who I'm looking for, who I've been working on. We also have the ability to have a type ahead lookup in here that's going to allow you to just start typing, and it's going to start to limit who shows up on that list. So you can search anywhere in the string. You can search for the last name, the first name, the date of birth, the MRN. If you use anything in that string, it's going to start to look throughout the entire eFusion platform for that patient. Now you'll notice once I've located one of these patients, I'm going to be able to get 3 different places. So if I actually hover over that patient, you're going to notice that I can click on his name, which will take me to the patient details screen. So if I need to update any demographics information, the original insurance information, the coach's information, or the PCP on that patient, I can also, notice he's been added to the top of my last 10 patients now. I can go ahead and start an intake for that patient. So this takes me to my patient intake screen, automatically fills that patient in. So if I have to schedule a second surgery, if that patient's had their left hip done, they're going to do their right hip after this episode's completed, I can start that intake or schedule that surgery as well. I can also see all of the patient's episodes. So you'll see he already has a current episode for that hip that's in processing. I can go to that patient profile page from here as well. So there's 3 points of navigation that you can get out of this global patient search / last 10 patients viewed that are extremely helpful in terms of reducing clicks for those care managers.
Thanks, Paul. That's actually really helpful. Another thing, that I think we hear a lot of is people don't really know where to go to submit information or get help. Could you show them exactly how they would do that?
Yeah, absolutely. And this is something that I try to hit on as much as possible. So there's 2 different places in this top bar where you can basically be able to get help with anything that you're experiencing within eFusion. So first, we have this feedback button at the top here. We have a smiley face and a frowny face. You can click on either of them. I would, much prefer to see lots of smiley faces. We'd like to make people happy here. So if you want to tell us what you like about us, or how Steve or I or somebody in development came up with some type of enhancement that really brightened up your day, definitely choose to click that one. If you have something you can tell us that, an idea that you might have that might make eFusion a little bit better, and we can start to go into development for something like that, you simply click on, what you might dislike, fill in that text box, hit submit. It sends over a ticket to Steve and I, so we can then push that on and discuss that with development and our clinical team, and get something deployed for you. We also have this help menu right next to there. A couple different things I want to hit on in here. So you have your customer support page. On that customer support page, you have your ways of getting in contact with our customer support team. If you have any questions, we have a line you can call, you can email us, and then we have our ServiceNow portal that you can go to. Also, the last 2 things I kind of want to hit on, you have your care management user guide. You can go into this user guide at any time. It's available 24/7. If you're looking to answer a question you might have without speaking to somebody over at customer support, you want to find it yourself, you can come into here. This is literally the entire guide to eFusion. you're able to go through here and, click on the table of contents. You can actually just use a Control F is what I like to use too, if you maybe know what you want to search, and you can go through and search the document that way for your answers. So you can go through the actual user guide as well. So we have one for both the CM platform and the analytics platform. The last thing I want to touch on here is our release notes. So we do a release at the end of every month on the last Thursday of the month at usually around off business hours, so usually around 9 p.m. or so, and then it's in for that last Friday of the month. As soon as we do that, we deploy our new release notes. You'll be able to find them. We do them by quarter. So if I actually click on the last month's release, you'll see what we released in January, what we're working on soon, and you'll be able to basically find out what we worked on, what we released in the last month, what we've made fixes to, whether it be bug fixes or new enhancements, new functionality. But we also, aside from the release guide, we do an office hours, and that is the first Tuesday after that deployment. So immediately after that deployment, we deploy Thursday night again, last Thursday of the month. That Friday, you'll have the new content in there, the new release notes. That next Tuesday, we do a office hours where we do a webinar that's live with myself, Amanda, Steve, where we go over all of those enhancements and answer questions right there with you. So those are the key places you can go for help or to find out, what we're working on or what we've deployed. But with that being said, I'm going to turn it over to Kristen Hall. She's going to talk to you all about how to get your questions in about this webinar.
Amanda and Paul, thank you so much for that information. All data presented during today's webinar is fictional. It was created to demonstrate the capabilities of eFusion and in no way related to any real individuals or entities. Should you have any questions about this webinar, please reach out to questions@fusion5.us and we'll respond in a timely manner to your questions. Thank you so much for joining our webinar today, and we look forward to speaking with you.